Have you ever wondered if your blood sugar level is okay, or if it might be higher than normal? High blood sugar, or hyperglycemia, can often go unnoticed until symptoms become more severe. Many people may live with elevated blood sugar levels without realizing it, increasing the risk of developing complications such as diabetes over time. Diabetes is a significant global health concern, contributing to millions of deaths each year. More recent data from the International Diabetes Federation estimated that in 2021, diabetes caused about 6.7 million deaths worldwide, accounting for more than 1 in 10, 12.2% of global deaths from all causes. In today's video, we'll discuss the 7 early signs and symptoms of diabetes to watch out for. Many people may have diabetes without even knowing it. Also, I'll share preventive measures that can reduce your risk of developing diabetes, along with habits and foods you should consider to avoid this devastating disease. So make sure to watch until the end. But first, go ahead and give this video a thumbs up and subscribe to the channel and share it with your loved ones, so many lives can be saved with your help. Do you or does anyone you know have diabetes? What part of the world are you from? After you've watched the video, drop a comment below. Number 1. Fatigue and excessive tiredness. This isn't the typical tiredness from a poor night's sleep. In fact, you might be sleeping well, but still feel extreme, constant fatigue. This could be a sign of diabetes. According to the American Diabetes Association, over 60% of people newly diagnosed with type 2 diabetes experience excessive tiredness. This is one of the most common symptoms of diabetes and is related to an imbalance of sugar in the cells and bloodstream. In other words, sugar doesn't properly enter the cells, leaving them without energy and causing fatigue and tiredness. Pay attention to what your body is telling you. 2. Tingling and burning in the feet. Did you know that diabetes and prediabetes are the main causes of burning sensations in the feet? That's right. Elevated glucose levels damage nerves, causing diabetic neuropathy, a condition that affects nearly half of people with diabetes. Diabetic neuropathy is diagnosed by an endocrinologist or neurologist based on the symptoms and the patient's medical history. The symptoms of numbness usually start in the feet and follow a pattern known as stocking glove pattern, where numbness extends from the toes up to the legs. Interestingly, when the numbness reaches about halfway up the calf, it's common for it to also begin affecting the fingers. So, be alert. If high glucose levels are damaging nerves, they may also be affecting your vision and kidneys. And for men, this nerve damage can lead to impotence. Although burning and numbness in the feet are uncomfortable and painful, they can serve as warning signs that your body is suffering. 3. Polyuria, frequent urination. Increased urine production, medically known as polyuria, is one of the early signs of diabetes. Under normal conditions, there is no glucose in the urine, as all glucose reaching the renal tubules is reabsorbed back into the bloodstream. However, in cases of hyperglycemia, typically with levels above 180 milligrams per deciliter, the amount of glucose reaching the kidneys is so high that they can't reabsorb it all, resulting in glucose being eliminated through the urine. Since we can't excrete pure glucose, the kidneys must dilute the sugar to eliminate it. Thus, the higher the blood glucose level, the more intense the glycosuria, excretion of glucose in the urine, and the greater the volume of urine produced throughout the day. 4. Skin changes. There are 2 important skin changes to pay attention to. The first is acanthosis nigricans, characterized by dark patches, usually found in the folds of the neck, armpits, and groin, with a soft and velvety texture. Take a look at these areas of your body. Does the skin appear darker than usual? If it doesn't lighten, even with scrubbing or using creams, this is a sign of insulin resistance and could indicate a predisposition to diabetes in the future. Why does this happen? In prediabetes or type 2 diabetes, the body may produce excess insulin, which stimulates skin cells to multiply quickly. In people with darker skin, these new cells contain more melanin, resulting in the darkening of these areas. The second skin change to watch for is skin tags, small, wart-like growths that typically appear in the same areas as acanthosis nigricans, the neck, armpits, and groin. Like the dark patches, these growths are also associated with insulin resistance. 5. Excessive hunger. In diabetes, cells cannot obtain enough glucose to produce energy, causing the body to interpret this as a state of constant fasting. The body needs energy, and the only way it knows to obtain it is through food. In type 1 diabetes, one of the characteristics is weight loss, even with frequent eating. This occurs because the glucose consumed isn't adequately utilized and ends up being eliminated in the urine. With cells receiving less glucose than necessary, hunger quickly returns. In more advanced stages of the disease, this cycle can break, leading to a loss of appetite, which further contributes to weight loss. In type 2 diabetes, the patient typically doesn't lose weight because their body still produces insulin. Although this insulin struggles to transport glucose into the cells, it can still convert excess blood glucose into fat. Thus, some glucose goes to the cells, some is eliminated in the urine, and the rest is stored as fat reserves. Before we continue, I've got some exciting news to share. If you want to get more engaged, I'm excited to inform you that we now offer channel membership. As a member, you'll pay a small monthly fee and unlock some amazing perks like early access to new videos, priority replies to your comments, members-only shorts, polls, quizzes, and special emojis and loyalty badges just for you. It's a fantastic way to support the channel and connect with us even more. Just click the join button and let's make this experience even better together. 6. Blurred vision. Are you having trouble seeing clearly? Seeing things blurred or hazy? This could be a sign of diabetes. When blood sugar levels are high, the excess glucose also affects the eyes. High glucose levels cause water to be drawn into the eyes, causing the lens to swell and change shape. This results in blurred vision. This is why people with diabetes often experience vision problems. Keeping blood sugar levels under control is essential to preserve eye health. It's worth noting that diabetes is one of the leading causes of blindness in adults worldwide, increasing the risk of conditions like diabetic retinopathy, cataracts, and glaucoma. 7. Slow healing wounds. Chronically high blood glucose levels lead to various issues in the body, including slow wound healing. This issue occurs due to reduced function of cells responsible for tissue repair, lower cell proliferation, and difficulty forming new blood vessels. Over time, diabetes can also damage nerves, resulting in decreased skin sensitivity, especially in the lower limbs. This means that foot injuries can occur and worsen without the patient feeling much pain or discomfort. Small wounds can take longer to heal, and if not properly treated, they may even worsen. How to diagnose if you have diabetes or prediabetes? You need to undergo blood tests. There are 3 main tests for this assessment. Fasting blood glucose. This is the most common test. Normal values are below 100 milligrams per deciliter. Levels between 100 to 125 mg per dl indicate prediabetes, while values of 126 milligrams per deciliter or higher indicate diabetes. Glycated hemoglobin, HbA1c. This test shows the average blood glucose levels over the past 3 months. Values below 5.7% are normal. Levels between 5.7% and 6.4% indicate prediabetes, and values of 6.5% or higher indicate diabetes. Oral glucose tolerance test, OGTT. After consuming a glucose solution, blood glucose levels are measured 2 hours later. It's important to remember that a single test does not confirm a diabetes diagnosis. The test should be repeated, and other indicators should be evaluated to confirm the condition. How to prevent diabetes? Healthy eating. Avoid ultra-processed foods and sugary drinks, as they increase the risk of diabetes. Eating whole grains, leafy greens, low-glycemic fruits, and legumes provide fiber and nutrients that help control blood sugar and promote satiety. Nuts and omega-3-rich fish provide healthy fats, benefiting insulin sensitivity and reducing inflammation. Additionally, tea without sugar offers beneficial antioxidants. Exercise regularly. Physical activity helps reduce weight, increase insulin sensitivity, and improve glucose control. Studies show that lifestyle changes, like regular exercise, significantly lower the risk of type 2 diabetes. Maintain a good sleep routine. Lack of sleep increases insulin resistance and glucose production, promoting the development of type 2 diabetes. Aim for 7 to 9 hours of sleep per night. Avoid alcohol consumption. Alcohol interferes with liver function, which can lead to hypoglycemia and hinder glucose control, increasing the risk of diabetes. Don't smoke. Smoking worsens cardiovascular, kidney, and eye complications for people with diabetes or those at risk. Have regular medical checkups. Diabetes is a silent disease. Regular screenings help detect elevated glucose levels early, allowing for timely intervention. Take medication when needed. Preventive medication for diabetes may be recommended in some cases, but only with medical guidance. Adopting these preventive habits helps reduce the risk of developing diabetes and promotes overall health. Are you aware of these early signs and symptoms of diabetes? Leave your comment below. If you found this video helpful, please type yes in the comments below. I also encourage you to check out these 2 videos we selected especially for you. Thanks for watching.